Hi everyone, I'm going to be reading the overview section of FDA guidance, officially called Applying Human Factors and Usability Engineering to Medical Devices, and then commonly referred to just as FDA guidance. Other sections are read by me in other videos. Okay, so this one does have a picture, and the FDA guidance is something you can just Google. So I would just Google that official name that I read out earlier so you can see all the images. Okay, so it's not really that important. All right. It is important, but it's not critical that you see it in order to understand it. All right, overview. Understanding how people interact with technology and studying how user interface design affects the interactions people have with technology is the focus of human factors engineering and usability engineering. Human factors engineering and usability engineering considerations in the development of medical devices involve the three major components of the device user system. 1, device users, 2, device use environments, and 3, device user interfaces. The interactions among the three components and the possible results are depicted graphically in Figure 1. Once again, look it up if you need to, really not essential. The Figure 1 caption says, interactions among HFUE considerations result in either safe and effective use or unsafe or ineffective use. All right, HFE/UE as part of risk management. And once again, HFE is human factors engineering, UE is usability engineering. Eliminating or reducing design-related problems that contribute to or cause unsafe or ineffective use is a part of the overall risk management process. Hazards traditionally considered in risk analysis include physical hazards, e.g. sharp corners or edges, mechanical hazards, e.g. kinetic or potential energy from a moving object, thermal hazards, e.g. high temperature components, electrical hazards, e.g. electrical current, electromagnetic interface, EMI, chemical hazards, e.g. toxic chemicals, radiation hazards, e.g. ionizing and non-ionizing, and biological hazards, e.g. allergens, bioincompatible agents, and infectious agents. These hazards are generally associated with instances of device or component failure that are not dependent on how the user interacts with the device. Should I just reread that? Okay. These hazards are generally associated with instances of device or component failure that are not dependent on how the user interacts with the device. A notable exception is infectious agents such as germs/pathogens, which can be introduced to the device as a cross-contamination caused by use error. Medical device hazards associated with user interactions with devices should also be included in risk management. These hazards are referred to in this document as use-related hazards. These hazards might result from aspects of the user interface design that cause the user to fail to adequately or correctly perceive, read, interpret, understand, or act on information from the device. Some use-related hazards are more serious than others, depending on the severity of the potential harm to the user or patient encountering the hazard. There's another image here. There's use-related it's a diagram. Use-related hazards and device failure hazards, and then the intersection is purple, but it doesn't address that intersection. What's the right word for that graph? I'm forgetting for some reason. Whatever. All right. So use-related hazards are related to one or more of the following situations. Device use requires physical, perceptual, or cognitive abilities that exceed the abilities of the user. Device use is inconsistent with the user's expectations or intuition about device operation. The use environment affects the operation of the device, and this is not recognized or understood by the user. The particular use environment impairs the user's physical, perceptual, or cognitive capabilities when using the device. Devices are used in ways that the manufacturer could have anticipated but did not consider, or devices are used in ways that were anticipated but inappropriate, e.g. inappropriate user habits, and for which risk elimination or reduction could have been applied but was not. All right. Risk management. HFUE considerations and approaches should be incorporated into device design, development, and risk management processes. 3 steps are essential for performing a successful HFE/UE analysis. These are 3 bullet points. Identify anticipated use-related hazards and initially unanticipated anticipated use-related hazards derived through preliminary analyses and evaluations. See Section 6. And determine how hazardous use situations occur. Next, develop and apply measures to eliminate or reduce use-related hazards that could result in harm to the patient or user. And next, demonstrate whether the final device user interface design supports safe and effective use by conducting human factors validation testing. This is C Section 8. Figure 3 depicts the risk management process for addressing use-related hazards. HFE/UE approaches should be applied for this process to work effectively. This is another diagram. I guess it's pretty good. It's a nice flow of the human factors process and addressing these related hazards in the risk management process. That's kind of the title of it. Okay. All right. So that's the end of the section. Sorry for not reading super clearly. All right.